Well. Good morning. Happy Tuesday. All right, today, something I want to bring up, and I want to bring this topic up because this actually happened. It's actually happening to one of my current physicians, unfortunately. I'm not sure if anyone knows about the outage that Oracle had throughout about 40 of their hospitals, okay? So their server system went down, their EMR, their engineers made a mistake and deleted basically a bunch of backed up information, let's just say it caused some issues for the physicians, okay? When a physician is working in a hospital without an EMR system, they can't pull labs, they can't pull, previous blood work, things of that nature. They can't get information to other physicians in the hospital or other entities of the hospital in the proper timing because their whole system's down, right? So, and I actually have a physician, he's dealing with this at a hospital in Alabama, and it happens, right? Things like this do happen, unfortunately. But just a couple things to bring in mind when a hospital is down with their EMR system. One, the increased administrative burden, okay? Yeah, you can use paper charts, to document things, keep things on file, whatever it may be. But this is very time consuming, okay? It's very time consuming. It's much different going through an EMR system to keep track of the records. There's a greater risk for medical errors, right? And a lot of this it says basically some things I pulled up to kind of understand what all happens when a system loses their EMR system. Well, you have a greater risk of medical errors. So without immediate access to full patient history, physicians may miss allergies, medication lists, previous diagnosis, lack of clinical decision support, so alerts for drug interactions, abnormal lab values, increases chance of mistakes, right? The communication breakdown. So no EHR means no instant messaging or task management between departments. I mentioned that a little bit earlier. Orders for labs, imaging, medications, often handwritten or phoned in, leading to miscommunication or even delays. Poor care coordination. Specialists, primary care doctors, nurses, therapists have trouble sharing patient information. Okay, the handoffs between shifts or departments are riskier without a centralized, up-to-date record. Okay, insufficient billing and insurance processes without the HR system. The coding, billing is more manual, which is more error-prone. Claims may be rejected for frequently delayed revenue. Documentation for audits, legal purposes, or insurance appeals are harder to compile. The regulatory and compliance risk, okay? Many regulations, HIPAA violations, Joint Commission standards, expert secured, traceable document practices, manual records can be harder to protect, easier to lose, and harder to audit, okay? Staff and morale burnout, well, this is where it hurts people. The administrative overload contributes to a burnout among a lot of physicians, nurses, and clerical staff. When you're down in the EMR system, you're having to constantly do paper charts, it even slows them down even more, okay? The newer generations of healthcare workers expect digital systems, okay? It's difficulty attracting and, retaining staff, right? Increases as well when you have that issue. The limited patient access. Patients can't easily get their own records, see results online, or communicate electronically with providers, okay? This affects patient satisfaction scores and hospital reputations. Slower quality improvement and research. So manual records make it much harder to analyze patient outcomes, identify trends, and measure quality metrics. So the hospital are at a disadvantage when applying for grants, accreditations, or quality improvement initiatives. And then really just as a summary, is without an EHR system, hospitals operate more slowly, with greater risk of patient safety, higher staff dissatisfaction, and worse financial performance. Okay? Modern healthcare systems consider EHR as critical infrastructure within their system, much like electricity, oxygen, right? Oxygen delivery. But anyway, that is the story of what happened. Now, this is important. This is a factor, something that impacts a lot of people, okay? And and I feel for the physician that I have worked with me. He's like, I'm working in a third world country, I feel like, and it's, he's stressed about it because it's like, I can't pull this stuff. I don't know this person's history. I can't find this, that, or the other. So it's an unfortunate event. And, a lot of folks may get frustrated with learning new EMR systems, EHR systems. But the reality is you need them. You really do. Okay. The hospital needs it to run more efficiently. And as always, if you're looking for locums help, call Nortec. John Harper's got you.